Hello, and welcome to Matter of Fact, a podcast from the Roy Howard Community Journalism Center, where we report what matters. I'm your host, Hilawe Tibebe. With support from the Scripps Howard Foundation, our center works to counter misinformation and strengthen truth-based journalism across communities in Southeast Mississippi. Today's episode is based on our R8CJC news article, Mississippi Expands Obesity Responses as Rates Continue to Climb. Before we dive in, some background on what the data shows and where it's from. According to America's Health Rankings, a state-by-state analysis backed by the United Health Foundation finds that about 1.2 million adults, which is about 40% of Mississippi's population, are classified as obese. Projections from the New England Journal of Medicine shows that those numbers will likely climb to 57% by 2030. That's a 17% growth in the next 4 years. State officials are calling it an epidemic, pointing to the health risks of obesity, claims that are supported by the National Institute of Health and an untold number of other medical studies. Without major interventions and fueled by the spiraling increase of chronic diseases, they warn that Mississippi's already strained healthcare system could soon be overwhelmed. In this episode, we'll take a look at how obesity is affecting Mississippians, what treatment and prevention options are readily available, and what new efforts are starting to take root in areas with gaps in resources and awareness. Across Mississippi, obesity shows up in exam rooms, workplaces, and classrooms, often alongside conditions like diabetes, high blood pressure, and joint pain. Director Rashida Hall is a family medicine physician and the founder of Hall Health and Wellness Solutions in Hattiesburg, Mississippi. She treats both chronic diseases and obesity.
So Mississippi is ranked number 3 as the most obese states in the U.S. with I would say about 40% of the adult population having obesity, which is about 1.2 million people.
Hall says many patients come to her clinic after trying diet and exercise on their own, often for years.
Weight loss affects a lot of different areas. I know a lot of people come to me because they've tried eating healthy diets and exercising and nothing seems to be helping. And so they want a fix. They don't want to just lose a few pounds and then gain it right back. So they're coming because they may be affected by prediabetes or diabetes, high blood pressure. They may have more pain. Knee pain and back pain are common complaints. And a lot of times it may just be confidence right there, or frustration. They've never been this big in their life. They don't understand why, especially in perimenopausal women, they're doing the same things that they were doing 20 years ago, and all of a sudden it's not working. They're, instead of either maintaining weight or losing weight, they're gaining weight. And so a lot of frustration, and that can affect mood, causing depression, anxiety, lack of, I would say, they just don't feel themselves, and they're not showing up at work or at home the way they used to because of the weight.
Hall added that her clinic focuses on what she calls 4 main drivers of weight: food, physical activity, sleep, and stress.
Things that affect weight can be what you eat, what you do as far as physical activity, sleep and stress. Sleep and stress are the top 2 that a lot of people don't realize can affect whether or not they're losing weight or gaining weight.
She links Mississippi's obesity rates to a broader set of economic and social conditions, including poverty, access to food, and long work hours. When time and money are limited, she says many of her patients turn to fast food and highly processed meals because they said those options were cheaper and more accessible than fresh produce or healthier options. Over time, Hall says those patterns increase the risk of obesity and the chronic diseases that often follow. Factors such as poverty and food inaccessibility affect the health and lifestyles of many across the state, including college student Michaela Douglas. Her weight loss journey began years before she had consistent access to medical care.
My weight loss journey really started in high school, so I Definitely weighed a lot. My heaviest weight was 250 pounds. And, my parents, people around me, they started seeing it as an issue. And I mean, I did too. I was doing things to lose weight, but it wasn't happening for me like it was happening for maybe friends that I was going with to the gym with or anything.
When glancing back at her upbringing, she recalls limited access to health care and healthy food, shaping her habits early on.
When I was younger, I didn't really feel like I had enough resources just because, I didn't come from a super privileged household or anything, so we didn't have the ability to go see the doctor anytime something was wrong. So I really had to take it upon myself to seek out the resources.
In her early adult life, Douglas took action into her own hands, pushing for answers and connecting with others who experienced some of the same symptoms that she was dealing with. Eventually, she found a medical provider and was diagnosed with polycystic ovarian syndrome, a disorder caused by hormonal imbalances in women that is often linked to weight gain.
Even though you're medicated for something like this, it doesn't mean that you're gonna automatically lose the weight. You've got to work for it.
She incorporated medication and major changes into her daily routine, including regular exercise and a more structured eating habit.
I found friends that love going to the gym, and I would go with them, and it's just kind of become a lifestyle now.
For those that are pursuing medical treatment, a newer class of prescription medications, known as GLP-1 drugs, are now a part of many weight care plans, including Mississippi Medicaid. In fact, the state started covering anti-obesity medications in 2023. But, according to the Mississippi Division of Medicaid's Drug Utilization Report, only 2.4% of adults on Medicaid actually received treatment in 2024. Hall says that points to a major barrier for those who don't have Medicaid or insurance that covers GLP-1 drugs. How are they supposed to affordably access their medication?
The branded name medications are usually costing people anywhere from about $300 to $1,500 a month. Now, if they're lucky and they have an insurance company that's paying for it, that sees the value in paying for the medication, then they may get it as low as $0 to $25 a month. But that's not the norm for a lot of people.
Hall adds that people without Medicaid depend largely on insurance coverage, local providers, and community health resources, factors that vary widely depending on where you live. At the state level, public health officials like Dr. Dan Edney are tracking the impact of obesity, especially when it comes to children. He's Mississippi's state health officer and the executive director of the State Department of Health. Reporter Morgan Gill asked him to compare where Mississippi stands to other states. His answer offers a snapshot of progress, and the distance still left to go.
How does the Mississippi State Department of Health explain Mississippi's persistently high obesity rates just compared to other states?
Well, first of all, better than we were when obesity was really being looked at initially as a disease and a population health outcome about a decade ago. I tell folks to look back then, we were 50th with impunity. We had zero competition for our spot. We owned it. And now we fluctuate year to year, anywhere from 47th in the country to 50th. We were 48th in 2023 and then 49th last year. Some of that relates to other states getting fatter. Some of it relates to us doing better than we've done. But we're nowhere where we need to be.
Edney says the greatest concern right now is what those trends mean for the next generation.
We've had a culture shift from where we were 50 years ago. When I was a child, we are just not as physically active as a population as we were 50 years ago. There's no doubt about that. Our childhood obesity rates are going up, and we now have more than 40% of our children are obese. And that is scary, because if they're obese in the 5th grade, then they're very likely to be morbidly obese, when they're 45, and they're going to have all the complications of diabetes, hypertension, heart disease that go with that.
But Edney highlights that the severity of the impact varies depending on the individual. For women who are overweight, it lowers their chances of a full-term healthy pregnancy.
Infant mortality It's the number one cause of preterm birth, and preterm birth is a leading cause of infant mortality.
Long-term change, he says, depends on sustained prevention efforts, particularly in schools.
We can also leverage technology to help us. As virtual technology is advancing and involving, virtual imaging into gaming, that actually gets, the gamer off the couch and their body's part of the game. We don't need to paint technology as evil. It can very much be part of the solution.
He says that's exactly what the Mississippi Departments of Health and Education are doing, developing an interactive virtual platform to deliver daily healthy education to students through gaming.
The last thing we want is another health class. That's going to be boring and will be a disincentive to students. Oh, good grief, here's another test I have to study for. What I would prefer is that we have an interactive platform that every day students K through 12 in homeroom or whatever local school system thinks spends no more than 15 minutes a day on the interactive platform that is instilling health promotion principles into the student and doing it in a fun way.
The goal, Edney says, is to make screen time active and build healthy habits from an early age. In other efforts, Governor Tate Reeves has reinstated the presidential fitness test for the 2026-2027 school year. And state lawmakers are also looking to remove candy and soda from the list of items that qualify for the Supplemental Nutrition Assistance Program. The new virtual platform, along with the anti-obesity medications offered for Medicaid recipients, joins other policies passed at the state level in an effort to combat a growing health crisis from the bottom up. The story you just heard was reported in part by RHCJC News student reporter Makiya Jackson. Makiya is a junior at the University of Southern Mississippi and contributed to this piece most notably by conducting the interview with the story's main character, a resident who shared her personal journey of weight loss and fighting stigma. Makiya joins us now to talk about her experience on this unique assignment and what she has learned through reporting on a stigmatized crisis that greatly impacts the state as a whole. Makiya, let's start with the central challenge, Mississippi's soaring obesity rates. What specific aspect of the facts surrounding obesity in the state stood out to you?
So the parts that stood out to me was definitely knowing just how many people were obese. This wasn't just an adult issue, this was also a child issue. And I learned that 40% of Mississippi was obese, and previously I didn't know that. So knowing about that and knowing that we are one of the states with the worst obesity rates was definitely shocking.
And I feel like that puts into perspective that an issue like this couldn't have just started yesterday. So it does go to show that this has been affecting the state for quite some time now. I know that you had the unique experience of interviewing the story's main character. Can you share what it was like to draft those questions and what you learned from her about the emotional toll of the health crisis?
Yeah, so interviewing her, I tried to make sure that the questions were definitely more sensitive, if that makes sense, because this is a sensitive topic and I didn't want to overstep with the questions. So I mostly just tried to focus on how her journey was instead of the things that she went through. If she felt comfortable talking about that, I wasn't going to stop her from talking about that. But I did try to focus on, hey, what are some things that you tried to do, or what are some things that you think could help other people as well?
What aspects of her interview may have or did change your perspective on the topic that you may have had at the beginning of the reporting process?
So a thing that stood out to me while interviewing our main character, which is Michaela Douglas, was basically about how she brought up her upbringing and how she didn't come from the richest family. And I learned from another interview that poverty can also affect, obesity and things like that, and how sometimes it's harder for people to take care of themselves and take care of their health if they are experiencing, severe poverty. It doesn't have to be severe, but it can also be lower cases of poverty, because it's kind of hard to focus on yourself when you're also like battling financial issues.
So, what does that say about the different stigmas, such as the idea that people just need to eat right and exercise?
I think that stigma can be very limiting, and it can be very insensitive to other people. For instance, the character, or Michaela Douglas, who I interviewed, she was diagnosed with PCOS, I believe. And that could cause her to, like, it will make it harder for her to lose weight. She mentioned that she was trying to eat healthy, she was trying to do the new things, but she still wasn't experiencing that weight loss. And so she had to go get diagnosed, and she had to go get medication for her condition. So I think that stigmatization, or I think that belief in general is just very limiting to that person. It can be very insensitive, as I mentioned before, because many people go through different things. Everyone's body is different. So yeah,
That makes a lot of sense, yeah. So, as a student journalist, this story required, navigating complex sources, not just the residents, but the state health officer and private practice doctors alike. Was there a specific part of the storytelling process that might have been difficult for you and the team?
The part that stood out to me, or the part that was the most difficult for me, was I've never like been in the shoes of like someone who was going through this. So I did kind of want to put myself in their shoes to make this not only like it's already a hard topic for people to go through, or a hard thing for people to go through, but I wanted to make sure that they felt comfortable enough to share their story and make their voice be heard in a respectful tone and manner.
And that's always very important when reporting on issues in underrepresented communities. Did you know about the different initiatives that state officers and health officials have put into place, and what does that look like to you as far as combating the issue of obesity in the state?
So I actually didn't know about that. But when we interviewed, the state health officer, I did learn a lot about what they were doing, and I do admire what they're doing. I know that they've mentioned educating the children about how obesity can affect people, and how to combat these conflicts and issues, since it's also a problem in children as well, not only adults.
Makiya, thank you for your reporting and for helping us understand the various complexities surrounding a major health crisis in the state. Now it's time for What is True, our fact-checking segment where we break down common claims, talk about how to verify them, and give you tools to spot what's real. Joining us is Walker Scott, our What is True Media Literacy Coordinator. Walker is over our fact-checking investigations and leads the center's Ask Me What is True community media literacy trainings. Walker, this episode focuses on the health crisis and the state's response. How does media literacy connect to the issue of obesity, particularly when people are seeking information about diet, treatment, or quick fixes?
According to the National Library of Medicine, mass communication sources, including the news media, provide fundamental frameworks through which most people from developed nations come to perceive and understand the contemporary world. Therefore, media literacy is crucial when navigating a saturated landscape such as health information. When people search online for health solutions, they face conflicting claims, fad diets, and biased product endorsements. Media literacy provides the necessary filter. It teaches us to ask, who is producing this content, and what is their motive? Learning to distinguish between credible research and sensational, biased content is the first step in making informed, safe health decisions, especially when tackling a crisis as complex as obesity.
Misinformation may tend to surround new medical treatments, like the new anti-obesity medication being covered by Medicaid. What are some key steps listeners should take before accepting or dismissing any new health claims that they see online?
The most important step is to go to the source. Don't rely solely on the headline or a social media post. For any new medications that you're weary about, follow these 3 simple steps. First, check the credentials of the person making the claim. Is the person making the claim a licensed physician or a research scientist specializing in the field? If the answer is no, that is a sign to take a deeper dive before believing any claims. Then, look for balance in information. Reputable medical information presents both the benefits and the potential risks of a certain practice, procedure, or treatment. If a source only uses exaggerated language about success and ignores possible downsides, it's likely biased. Lastly, make sure to find the primary data. Search for the official FDA drug approval documents or articles published in peer-reviewed scientific journals like the New England Journal of Medicine. Information from those sources offers objective insight, ensuring an educated health decision. For coverage and updates related to Medicaid changes within the state, residents can check the official Mississippi Division of Medicaid website itself.
So Walker, we see many miracle cure articles or influencer posts promising dramatic weight loss in today's media landscape. What are some of the biggest red flags that should signal to a consumer that a health claim might be misleading or dangerous?
A couple of major red flags to watch out for are the illusion of immediate results and blatant appeal to emotion. Sustainable health changes are often gradual. Therefore, it is important to ensure there are credible medical statistics before believing a claim that promises dramatic results in an unrealistic amount of time. Additionally, avoid content that relies heavily on emotional anecdotes. For example, the claim, "I cried when I saw how fast I got my results," may help persuade customers into promoting a treatment. However, that claim alone does not reveal anything about the actual effects of the drug.
So beyond diet fads, the story discusses the stigma surrounding obesity. Tell us a little bit about how media literacy can help us critically evaluate the language and imagery used in media coverage, and how that might perpetuate harmful stereotypes about weight and health.
Media literacy helps us move from passively consuming content to critically analyzing it. So, when you see coverage on obesity, make sure to distinguish the framing and focus of the media you consume. As far as framing, observe the portrayal of the individuals being represented, straying away from negative or dehumanizing imagery and language that reinforces stereotypes. As media literate consumers, it is on us to recognize the visual narratives that often shape our subconscious bias, whether intentional or not. And with the focus of the coverage, it is important to take note which aspects of obesity the given article is highlighting. Stray from media that uses language blaming an individual for their health. Rather, focus on the various systemic and biological drivers in play. As Dr. Hall pointed out, there are many factors tied to the conversation surrounding obesity, and responsible journalism reflects that complexity.
That's what is true with Media Literacy Coordinator Walker Scott. You can learn more about the program or submit a question of your own at r8cjcnews.com/WITREQ or by calling 601-266-TRUE. That's 601-266-8783. This episode was adapted from our R8CJC News article, Mississippi Expands Obesity Response as Rates Continue to Climb. We'd like to take a second to acknowledge the journalists who originally reported this story, Morgan Gill, Samin Chan, Nishit Sharma, and of course Makiya Jackson, who we had the privilege of chatting with earlier in the show. You can read their full story and see related reporting at racjcnews.com. Be sure to follow us on all social media at R8CJC News to keep up with more stories just like this one. As always, thank you for listening and for spending time with us as we take you behind the scenes of the Roy Howard Community Journalism Center. I'm Hilawe Tibebe, and this is Matter of Fact.